Today on CityLine, Reimagining Healthy Communities. The coalition's working every day to find equitable solutions. Good morning to you, and thank you so much for joining us. I'm Jessica Brown. The City of Boston is working to ensure every resident can live a longer, healthier life. The city recently released its first ever Black Life Expectancy report, and researchers reveal Black residents in Boston consistently live fewer years than any other group. From 2013 to 2024, the life expectancy gap actually doubled, going from 3.3 years to 6.6 years. Now the city is working to address the health disparities behind those statistics. Joining me now is Boston's Commissioner of Public Health, Dr. Bisola Ojikutu. Thank you so much for being with us.
Thank you for having me.
This is such an important issue to talk about here. The research is clear. Black Bostonians continue to have the lowest life expectancy of any racial ethnic group. I want to talk a little bit about these numbers here, because between 2022 and 2024, Black women had an average life expectancy of 80.1 years. That's about 6.4 years fewer than other women. And then Black men had an average life expectancy of 71.8 years, which is 9.3 years fewer than other men. That is the lowest life expectancy of all groups included in this research. I mean, when you see these numbers, it's hard to see. What are the leading causes here?
So I think it's complicated. So these numbers, they're stark, they're jarring, they're disturbing. And actually, if you look at the gap between Black life expectancy and other residents in Boston over the past decade, the gap has actually doubled. Okay, so that was the 3.3 to the 6.6 years. So what's driving this? I think that's the key question. So contrary to, I think, popular opinion, individual behaviors, personal behaviors are not the primary drivers of the lower life expectancy amongst Black individuals. So individual behaviors like what we eat or how we exercise. Now, I'm not saying that's not important. So if you're doing your 10,000 steps, keep doing it. Decrease your processed foods. But if you really look at those stark inequities, the long-standing, over decades of gap between Black individuals and others, the driver is really those bigger issues, those structural issues: racism, community disinvestment, limited access to those resources that we know contribute to better health outcomes, like wealth creation, like economic opportunity, like housing, like education. Those are the factors that are actually leading to lower life expectancy. And that's what we need to work toward, particularly here, but this is a national problem. But here in Boston, we launched Live Long and Well, which is our city's commitment to addressing these drivers. You know, we talk about data a lot, but we need to talk about action. And I think that's what's most important.
We're going to talk more about that action here in just a moment, but you did talk about a little bit about the systemic inequities here that are at play. Let's dive deeper into those, because that is a big factor here, and you're seeing it show up in different health outcomes. What are those?
Exactly. So these would be sort of what we would call the primary drivers, or I would say that these are the things that are on the death certificate, right? So if you look at the top four, particularly for Black men, but for Black people overall, we're talking about overdose mortality. We're talking about screenable cancers like colon cancer, like prostate cancer, like breast cancer. We're talking about heart disease or cardiometabolic illness. So that's really thinking about obesity, type 2 diabetes, high blood pressure. Those are the drivers then to heart disease and stroke. And then for Black men, number 4 is actually still homicide, if you look at our data for the last few years. So those are the things that we are targeting specifically while we're looking at these root causes that I just talked about, the structural factors.
I know on Wednesday, the Health Commission is hosting its first Black Men's Health Activation Summit. Talk about what's the hope for this event and how can this serve as, you know, like a catalyst for change?
I think this is a great opportunity. Like you said, it is our first time doing this. So it's the Black Men's Activation Summit. And we specifically called it Activation because it's not just about looking at the past and bemoaning the data. It's really about thinking about the future. What is it that we need to do? What is it we need to do differently? What are the resources we need? What are the investments that we as a city are going to commit with our many partners to actually moving this forward and closing those gaps?
We're talking solutions, right?
Solutions.
We know the summit will also help you decide how $1 million will be used from the commission to be addressed towards men's health. What does the commission hope that investment will accomplish? What are those solutions possibly that you guys will be discussing about?
Absolutely. So I'll just say the investment, $1 million, it's actually coming from funding that we got for the declaration of racism as a public health crisis. It's not a one-time $1 million. It's actually going to be an annual investment because we really aren't going to be able to do much with $1 million. And we're certainly doing this in partnership with lots of other people who are investing. But just from our end, what we're hoping is that we'll be able to fund community organizations in partnership who are already doing work on Black men's health to really fortify and strengthen it. Because we believe, and I think this is true, that what we need to do is invest more deeply in the work that we're doing. We're doing great work. You know, as a city, we are resource rich. You know, there are lots of great people. I know you've had them on the show who are doing amazing work. They don't always have the funding to really capitalize and amplify that work that they're doing to make the difference that we know that they could make if they had the resources to do so.
To really fuel
That's
those.
Right. That's right.
That's great to hear. The report has led to several new partnerships and initiatives. Aside from the summit, what other actions are being taken by the city here?
So a lot of actions are being taken. Again, we're not a city that sits back and lets things stand as they are, but I think that what we're trying to do is shine a light and really focus our attention. So Live Long and Well, that's our initiative. We launched it last year. This is our commitment to closing life expectancy gap, but also improving quality of life overall. So we're really looking at a lot of different initiatives. We have a $10 million investment by Atreus Health Equity Foundation, amazing work. It's just getting started. They're in their planning phases. They're looking particularly at Dorchester, Mattapan, and Roxbury, really thinking about economic opportunity and how does that then relate to health outcomes. So how do you do complex multi-level interventions so that you're thinking about wealth creation, economic opportunity, but how is that impacting our health? So really studying it, doing the work, and studying at the same time. We also have a wonderful new investment by Dana-Farber. Dana-Farber is an excellent partner, as many of our health systems are. They're putting forth $1 million. They've done a lot in the past, but just more recently, $1 million to really think about cancer inequities, screening, diagnosis, early intervention, particularly in our communities where it doesn't always happen. So there's a lot of work that's happening.
It's important, and I'm glad to hear about early intervention because, you know, we keep seeing these diagnoses happening younger and younger and younger. And so this is also kind of targeting that as well.
Exactly. We're really trying to be as proactive as possible, get people engaged, get communities involved in the solutions because oftentimes it's communities that have the best solutions.
Dr. Bisola Ojikutu, we thank you so much for being here and for your insight on all of this.
Thank you for having me.
Yeah, thank you.
Great.
All right, coming up, equity through policy, how state lawmakers are working with health leaders and the legislation in the works right now.